Good afternoon, everyone, and welcome. We're so glad you're here for our first virtual event of 2026. The Path Forward, TAG's vision for HIV, TB, and Hep C. Today is a window into what's possible when science and advocacy come together and community work together at the right moment at the right time. Today, we'll walk you through TAG's mission, vision, and values. Key program highlights, a live question and answer, and how you can help shape what's next. My name is Jason Brock Whetstone. I am part of TAG's development team. Here, I will guide you through today's conversation. On behalf of the entire TAG staff and board, thank you for joining us and for being part of this community. Today, you'll hear about the challenges ahead, TAG's approaches to tackling them, the progress we're making, and why continued support is critical, especially right now. We also would like to take a moment to recognize our partners, advocates, and supporters who help make our work possible. You are essential in helping us tell our story. Just the other day, our executive director and founder, Mark Harrington, mentioned moments like this bring him back to the early days of TAG, grounding us into why we started and reminding us why this moment, this movement is so important. For those of you who are newer to TAG, Treatment Action Group works to ensure that life-changing research and treatment for HIV, tuberculosis, and Hep C reach the communities most impacted. And now, to help ground us in our work, I'd like to introduce you to an amazing member of our team. Join me in welcoming Erin McCall, Senior TB Project Associate.
Hello, everyone. As we gather today to look at the path ahead for TAG and what comes next in our struggle to realize the end of HIV, tuberculosis, and hepatitis C pandemics, I am really honored to have been invited to speak about the legacy, mission, and vision that this work is built on. TAG grew out of the ACT UP Treatment Data Committee. Next slide, please. Alongside outside activism, including the famous Storm the NIH action and countless die-ins across the country, the early Treatment Data Committee was teaching themselves microbiology and clinical science, ultimately becoming experts in the science of HIV/AIDS, as well as expert advocates. They brought their advocacy to meetings with the National Institutes of Health, the Centers for Disease Control, and leading research and policymakers worldwide. Through this, TAG's founders saw how much research was proceeding without input from affected communities and individuals, and how much room there was to improve the research agenda and outputs by considering the needs and interests of those who stand to benefit the most from scientific advancement. In their advocacy and activism, the nascent TAG team demanded that communities be acknowledged as equal stakeholders and experts, included in any and all conversations where decisions were being made about them. It is from this storied legacy and commitment to including community voices in every decision, be it policy or the research agenda itself, that TAG developed its vision and values. In 1992, when TAG was officially founded, it envisioned the end of the HIV pandemic through the discovery and development of life-saving diagnostics, preventives, and cures. TAG began with a foundational knowledge that discovery alone was not enough to end pandemics, but the future they envisioned was based on worldwide access to those novel tools and strong public health infrastructures that support dissemination and healthy communities. Further, TAG operates from a position that none of this would be possible without the involvement and input from the communities most affected. And it is this early vision that has shaped the vision in 2026 and carried us through to today, expanded to include tuberculosis and hepatitis C. Through 30 years of TAG's advocacy, we have seen immense progress in the battle against these pandemics, and yet many challenges and future victories remain. TAG has doubled down on its mission to catalyze collective action, led by affected communities, scientists, and policymakers unified in their goal of ensuring that all people living with or impacted by HIV, tuberculosis, or hepatitis C are able to benefit from the human rights to health and to science. And here you can see TAG remains focused on being science-based activists. While the years, the challenges, the enemies, and the battlefields have changed, we are still dedicated to expanding and accelerating vital research and supportive policies that center the voices, needs, and preferences of communities in each and every decision to realize a future free of HIV, TB, and hepatitis C. TAG was built on and of the shoulders of giants, titans in not only research advocacy, but in activism at large. work that has informed so much of what is possible if the downtrodden work together in solidarity to realize the potential of a better world. As we look forward to what comes next in TAG's work and in the struggle to realize the end of these pandemics, we always keep the strength and lineage of our forebears in mind, standing tall on their shoulders with our eyes on the horizon of the world we hope to build. And I would like to end by thanking all of you joining us today and being part of TAG's work to realize our vision of a healthy, just world free of HIV, tuberculosis, and hepatitis C epidemics. Jason?
Thank you so much, Erin. That was a powerful reminder of why this work matters. Now, let's bring this mission to life. In the next segment, you'll hear directly from our program leaders. To begin, it's my pleasure to introduce Rico Boone, HIV Project Director.
Hello, everyone. Thank you for joining us today to learn more about our work over the past several months. As you may know, TAG's HIV program is comprised of 3 arms: our basic science, vaccine, and cure project, programming and activities focused on HIV prevention, education, and related policies, and third, our Act Now and AIDS Coalition, led up by Director Deasia Lee, which is focused on federal and state level policy advocacy centered around ending the HIV epidemic. All of these interrelated components are critical to ensuring that our communities of people living with HIV and groups affected by HIV are educated and mobilized during really unprecedented dismantling of domestic and global health programs. So here are some highlights of what we've been working on over the past several months. Next slide. So beginning with protecting HIV funding. As everyone knows, the shifts in domestic and global HIV-related policy have threatened to reverse decades of progress towards eliminating HIV in the US and globally. In response, we've issued several public statements and submitted public comments to federal requests for information. A notable example over the past quarter was our submission of recommendations for the recompetition of the major HIV clinical research networks. Among many other recommendations, we recommended continued support of a balanced portfolio of basic, clinical, and implementation science, including the continuation of each of the 4 current networks, as well as strategic codified mechanisms for cultivating junior career scientists. Notably, the shifts haven't really occurred just at the federal level, but also at the state level. So we've also continued to be actively engaged in coalitions and campaigns, such as the Save HIV Funding campaign, to really push back and monitor ongoing multi-level policy developments, budget appropriations, and drawing attention to local advocacy efforts, as well as participation in direct actions and protests, providing resources to people and groups who are motivated to join such protests. So you may have seen in the news coverage over the past several months, several protests that TAG has joined in partnership with Health Gap, Housing Works, the Save HIV Funding campaign, among others. Next slide. We also have been working to advance equity in HIV science. As we all know, there's been a lot of rollbacks of diversity, equity, and inclusion, and the dismantling really of the federal HIV infrastructure at CDC, NIH, et cetera. Approaching World AIDS Day last year, 2025, for example, we were contacted by a Brazilian newspaper journalist who interviewed me and asked for, just an overview of sort of what the current landscape looks like for the future of ending the HIV epidemic. And one of the things I noted in that interview, because it was around the same time, that the East Wing of the White House was being demolished. And I drew that same analogy to what is really happening to our HIV public programs and infrastructure in the US and globally. Additionally, we've also had Richard Jeffries, our Basic Science Vaccine and Cure Project Director, gave a very comprehensive overview of HIV cure research from beginning up until now for the Wistar Institute. This was a very prestigious, invited guest lecture that he was invited to by the Wistar Institute, and we welcome you to check that out on their website when you have a moment. In addition, Richard's work also concludes maintaining a database that highlights the status of demographics of participants in HIV cure-related clinical trials. So in this way, by monitoring constantly the inclusion of different populations and groups in clinical trials specifically focused on HIV cure, this is our way of making sure that we continue to advance equity in HIV science overall. Next slide. We also continue to take the conversations to Capitol Hill. During AIDS Watch, ANIA Hill Days, and civil disobediences inside Congress members' offices, such as Susan Collins, as you may have seen. We had participated in a protest as well for that. For example, as a steering committee member of the Prep and Black America Coalition, during AIDS Watch this year, just a couple months ago, we met with advocates right before the Hill Day to educate them about the Black HIV prevention research agenda developed by Prep and Black America Coalition to provide advocates with critical talking points ahead of their meetings with congressional offices. Next slide. And finally, mobilizing advocates and activists has always been central to TAG's mission and takes on even more importance given the urgency of everyday developments under the current executive branch and Congress. So far this year, that has included bringing together nearly 100 people living with HIV, researchers and other advocates in person and virtually for the annual 2026 pre-CROI Community Workshop on HIV Cure, which took place in Denver, Colorado. As well, there was also ANIA's Act Now and Days Coalition's convening of a group of nearly 50 stakeholders in Jackson, Mississippi, who are committed to ending the HIV epidemic there. And one thing that really stood out to me during our time in Jackson was that there was a very palpable energy of these advocates in the room, really sort of focused on protecting HIV programs and research, et cetera, in Mississippi and in Jackson in a way that, really sort of holds true to what we know of the freedom movement in Mississippi. And so I'm very appreciative of that. And we are carrying that forward in July of this year. ANIA and TAG are currently organizing an advocacy summit to be co-hosted in Baltimore in partnership with Equality Federation, Free State Justice, Us Helping Us, which is a local CBO based in DC and Maryland, and other groups, where we'll be including within a larger mobilization focus, a spotlight on HIV research-related advocacy. And we'll be hearing directly from HIV research programs that over the past year and a half have experienced funding cuts by the federal government. To learn more about the upcoming Advocacy Summit and to share information with your Baltimore-based advocates in your networks, please be on the lookout for further details on ANIA's and TAG's social media and forthcoming communications. Thank you.
Thank you, Rico, for that insightful update and for your leadership in advancing HIV research and access to care. Next, we turn to tuberculosis, one of the world's deadliest infectious diseases, a critical focus of TAG's work. Please join me in welcoming Mike Fick, co-director of our TB project.
Thanks, Jason, and hi, everybody. Thanks for being here today. I am really happy to share some news from TAG's TB program, and on behalf of my co-director, Lindsay McKenna, we can move to the next slide. TB is a really big part of the work that TAG does because TB is the world's leading cause of death from an infectious disease, and it remains the leading killer of people living with HIV globally. So it's central to all of the work that we do here. And our TB program at TAG does work under 3 guiding stars. We work to protect and expand funding for TB research because if we hope to end this epidemic, we need better tools. When those tools result from research, things like better medicines, vaccines, and diagnostics, we work to ensure that everybody at risk of TB, no matter where they live in the world or what their circumstance, can access them and benefit from their protection, an idea that we refer to as the human right to enjoy the benefits of scientific progress. And then we translate TB science into policy and community action. We like to call ourselves translational advocates in the sense that we have a foot in different worlds. We act as bridge builders between advocacy and science, between policy and community, and make progress on ending TB by bringing different voices and stakeholders together. So in the next couple of slides, I want to share an example from each of these 3 areas of work that we're focused on over the coming year. And you can move to the next slide. One of the first things that the Trump administration did at the start of last year was suspend US government funding to South Africa. And this was a real disaster for TB research because South African science has been the engine of TB innovation over the last 2 decades, and a lot of that has been supported by the US government. It's hard to think of a major advance in TB treatment, diagnosis, or prevention that hasn't relied on science by or conducted in South Africa. And when these funding suspensions were being rolled out, we mobilized quickly, and together with our colleagues at Doctors Without Borders and at South Africa's own NIH, the Medical Research Council, we did an assessment to understand the impact of suspended US funding on the TB research enterprise. And what we found really alarmed us. Up to 12 important clinical trials representing 30% of the participants in TB research globally that were at risk of being stopped early or suspended indefinitely. And so for us, it was very clear that restoring funding for South African research had to be a priority. And it's going to be a big focus of the work that we're doing this year, working together with our allies in South African civil society. For us, I think it's a commitment to making sure not only that TB research moves forward, but that this unique partnership between the American people and the people of South Africa, which has been one of the most productive scientific exchanges between countries of the modern era, is able to survive and continue. Next slide. It's not all bad news in TB research. There is a lot of excitement about new vaccines against tuberculosis. The only existing vaccine against TB dates back to 1921, and it protects infants, but it doesn't offer very much protection to adults or to adolescents, which is where most of the TB epidemic sits. And so developing a new TB vaccine has been a big emphasis of TB science. And finally, we have some very promising candidates that have entered late stages of clinical testing, and results from those studies could be available as soon as 2028. And if those studies show that these vaccines are safe and effective, they will be true game changers, but only if they're accessible, affordable, and accepted by communities. So for us this year, we're spending a lot of energy in helping donors, policymakers, and advocates anticipate access barriers to new TB vaccines so we can get ahead of the curve. Trying to solve problems before they solidify. We've published and commissioned original research into things like vaccine supply chains, including the report here of the tree trunk image. One of the vaccines that's most promising has a key ingredient that relies on sourcing from a tree that only grows in Chile. And so we looked into that. We've also been advocating to elevate community voices in global and national policy spaces to ensure that communities affected by TB have decision-making power in how new TB vaccines are implemented and rolled out. And the idea being that by including communities in policymaking, we can get ahead of things like vaccine hesitancy and not squander the opportunity a new vaccine would offer. Next slide. There's also a lot of good news on the diagnostic side of things. One of the reasons that TB remains a leading infectious disease killer is because every year millions of people go undiagnosed. And they go undiagnosed because TB tests are too complex, located too far away from where people live, too expensive for governments to implement at scale. And we've been locked into these inadequate tests for a decade now. Finally, this year, the World Health Organization recommended a new type of TB test, what we call near point of care tests. And as that name implies, these tests can bring diagnosis closer to where people live, but only if governments adopt them. We have a window of opportunity this year with the Global Fund offering financial support to countries to implement these new tests. And we're working to ensure that advocates in countries have the evidence, the arguments, and the information they need to urge their governments to include ambitious commitments to expand TB testing into communities that haven't had access to it before, using these new tests as the opportunity and platform to do just that. I want to end by just saying that this hasn't been an easy few years to do TB work. Progress against TB was really set back initially by the COVID-19 pandemic. And then just as we were starting to recover from that, the Trump administration actions knocked us down again. But at the same time, it's really a privilege to show up to work every day and get to work on tuberculosis, especially at a moment where there's so much scientific potential. And our task is really to ensure that that potential is converted into reality. And your support of our work as we do that is just immeasurable and means the world. So thank you. And back to you, Jason.
Thank you, Mike, for shedding light on both the urgency and the progress in TB. Now we shift to hepatitis C, where intervention has created real opportunity, but access remains a barrier. I am pleased to introduce Joelle Dontio-Offenbutum, Acting Program Director, to share more.
Thanks very much for the warm introduction, Jason. Earlier this year, we had a meeting with the principal investigator for a clinical trial on a long-acting single-shot injection that would cure hepatitis C. And during this meeting, we recommended the inclusion of people who use drugs in a phase 1 trial because these populations have the highest burden of hepatitis C virus, as you may know. And of course, for that reason, their inclusion in the very first phase of this clinical trial is critical. And this was actually very well received by the researcher. As you would have noticed, there is rising skepticism towards science, which is eroding public trust in health products such as medications to prevent or treat diseases and also vaccines. And this skepticism in science is resulting in low uptake of health products and, of course, worsening population health outcomes. To address this, we believe that community trust in the science and community engagement between people, you and I, who use these health products, and researchers who develop these products is key. Through community engagement, doubts, questions, and even concerns that people have about these different health products can be addressed and clarified. Now, one of my main roles at TAG is to bridge the gap between researchers and people by providing a platform for engagement to build trust in the science involved in developing health products. The overall goal here is to ensure the uptake of these health products to both prevent and treat diseases. An example of how I do this at TAG lies within a project called Longevity. Now, Longevity is developing long-acting therapies to prevent malaria and tuberculosis and a single-shot injection that would cure hepatitis C virus. Within this project, we bring together a group of people under what we call a community advisory board to engage with the researchers who are developing these long-acting therapies. Aside from the meeting I mentioned at the beginning that we had with the principal investigator for the hepatitis C virus drug, we have also contributed to the development and implementation of surveys among people with Hep C, people who have been cured of Hep C, and people who inject drugs, and also among policymakers and healthcare providers. Now, the goal of the survey these surveys, there were two of them. The goal of these surveys was to get the perspectives of these different groups of people about an injectable drug to cure hepatitis C. Now, the picture on my right is actually a picture of myself. It's actually myself and a fellow CAP member next to a poster that was based on one of these surveys and presented at a conference last year. And next week at the World Hepatitis Summit in Bangkok, we will be presenting some of these surveys again. In addition, we conduct research on long-acting therapies leading to publication, and we sometimes also organize webinars to discuss and engage with the community about long-acting therapies, and also to address various questions that people might have about these different therapies. For the future, we plan to continue to engage with these researchers to share community perspectives and hopefully shape the design of the trials to ensure diversity and inclusion, And we will also be strongly advocating for affordability of these therapies once they are developed to ensure that everyone everywhere has access to these. The photo on my left was actually taken at a protest against the US government funding cuts to scientific research in Denver last year. Thanks very much, and we invite you to continue to support our wonderful work at Treatment Action Group.
Thank you so much, Joelle, for that important perspective. Now, this work doesn't happen in isolation. Policy and advocacy are essential in turning research into real-world impact. Please welcome Lizzie Longnecker, U.S. and Global Policy Director, for an update on our policy and advocacy efforts.
Thank you so much, Jason. I'm so excited to be here with you today talking about our policy work and the approach that we're going to take for 2026 and for the future. What I most want to emphasize is that in 2026, TAG is shifting our stance from reactive to this new administration to proactive. In 2025, we were surprised by the extent of the destruction that was coming out of the Trump administration and how that was impacting our work. And this year, we have a better sense of how this administration is operating and also how future political tides can work in our favor. And we're able to leverage that to really take a proactive stance this year in a few different ways. One, we're working together with the minority staff in key congressional committees who, given midterm outcomes that we think might shift the balance of power in Congress, will then be in the majority. So we're able to work with them right now to make sure that our top priorities are in their framework going forward, and that when they do assume the majority, when that power balance shifts, that our policy priorities when it comes to HIV, hepatitis C, and tuberculosis are a core part of their framework and approach for the next congressional session. We're also trying to work around some of the funding constraints that we're having right now. Obviously, we want to continue funding HIV, TB, and HCV research and programs as best as we possibly can. And we're continuing to advocate for robust funding. However, in addition to that, and recognizing that there are funding challenges that we may not be able to work around in every single circumstance, we're also working to make sure that the details of how that money gets spent is best in line with our priorities and as TAG, and also best in line with a human rights-based approach that recognizes the rights and the dignity of everyone who is most directly affected by HIV, hepatitis C, and tuberculosis. Next slide. We're also working in partnership with other advocacy communities to ensure that legislation that we're in favor of doesn't just get passed, but gets passed in the best possible way for the communities that we're advocating on behalf of. So we don't just want to eliminate HIV, hepatitis C, and tuberculosis. We want to do so in a way that uplifts the humanity and, again, the dignity of people most directly affected by those three diseases. We're also taking a very exciting proactive approach in this coming year by launching Project Solidarity First, where we're recognizing that specifically in the context of tuberculosis R&D, a lot of the infrastructure that has been built up over decades was dismantled over the course of the past year or year and a half. We would never have chosen for that to happen. But given that it did happen, and we're now at this inflection point with a possible change in power coming soon or in the next several years, how do we want to rebuild that infrastructure and that TB R&D landscape in a way that best works for the people who stand to benefit most from that R&D? And we're bringing together stakeholders from across the R&D landscape, whether they are researchers themselves, advocates like us, ministers of health, and many other interested parties to make sure that we have a blueprint for the best possible way to rebuild this infrastructure when we have the political conditions to be able to do so. Next slide. In line with this approach, we have some very exciting updates just from the first quarter of the year. We've had the largest ever TB Hill Day in the history of doing so, in partnership with TB survivors, John Green's TB fighters, Partners in Health, and many others. We were able to join with over 300 participants from all 50 states. We met with every single Senate office, and our congressional briefing that is held to make sure that congressional staffers have the best available information about tuberculosis programs and research and the way that the pandemic currently stands. That was held in the largest ever room that we've ever had it, and it was a standing room only briefing. In addition to that, we are also engaging in direct action and activism, using an inside and outside advocacy approach so that we're able to both meet with decision makers and also protest when we need to get their attention and to ensure that we are getting our message across, whether it is through getting arrested or having our resources directly in their hands. Lastly, we have been able to join in partnership with a number of partnering organizations who have invited us to the table to be able to explain to them how best to engage in advocacy so that we can carry this message together, carry this message forward together on behalf of HIV, hepatitis C, and TB programs and research, and be able to do so as a comprehensive message from across the community. Next slide. These photos show just some aspects of those really exciting partnerships we've been able to build, whether it is protesting in the halls of Congress, holding meetings one-on-one with our representatives, engaging our community partners in how to best move forward in advocacy, or speaking directly to decision makers at federal agencies and putting our statements forward for the public. Next slide. But there's also a way that you can engage directly in this work from where you are. So we really encourage you strongly, as part of the work that we're doing, to build a relationship with your elected officials. You can find your federal legislators by visiting congress.gov/member/find-your-member, or calling the Capitol switchboard and asking to be connected to your legislators' offices, health legislative assistants, or Health LA. When you connect with them, share your story about how HIV, hepatitis C, and tuberculosis have affected your life, the lives of your loved ones, and really why you care so much about the programs and research that are necessary to eliminate these diseases. Make sure that you are bringing your personal story forward and building that relationship with your elected officials over time. Continue calling them back and emailing them. Really bang the drum with those offices to ensure that you, as their constituent, really their boss, are able to tell them that this is something that matters to you and they are able to take action on it. And in the future, please look out very soon for TAG's Policy Action webpage, which will detail some of the specific campaigns where you can take action and utilize and leverage those relationships that you've built with elected officials. And with that, I will turn it back over to Jason.
Thank you so much, Lizzie. And thank you to all of our speakers for such thoughtful and powerful presentations. Now we would love to hear from you. We'll open up the floor for questions. Please use the raise hand feature and we'll call on you when it is your turn. All right, team, I did receive one question. What recent development gives you hope or momentum in this work? Any one of the program directors could answer that.
I can start for the TB side, and I'm sure my colleagues will want to add to this, but it picks up on something that Lizzie mentioned, which was the largest ever Hill Day on TB. Um, and I think looking at the number of participants who showed up in DC to advocate on tuberculosis and recognizing that a lot of them were people who are not like professionally in TB. They are people who've been inspired by John Green or inspired by prior TB advocacy by groups like TAG or Doctors Without Borders or Partners in Health to make a personal commitment to get engaged in this fight. And the movement of advocates in TB also includes more voices of people who have survived the disease or cared for people who've had it. And so we are building a movement that we haven't had before in tuberculosis, one that centers people with lived experience, but also is bringing in some really untraditional allies, younger people, people who are creative and bringing skills and talents to this. And it's a global movement. It's not just happening in this country, it's happening globally. And that's part of why a big focus of our program has been trying to find ways to elevate these community voices to ensure that these policymaking spaces are open to them. Because we have a lot of people who are engaged and are looking for ways to contribute to the fight against TB. And I think we need to give them space to do that. So that is something that has given me hope. Basically, the grassroots is kind of rising. And even though things sort of at the top of our political system don't look so great now for TB, having that grassroots support is really something that's been very encouraging.
I can add to that as well. I think something that has also been encouraging is just seeing the extent to which public action is really pushing back against the destruction that the administration is trying to cause, and the extent to which elected officials are really listening to the groundswell of support for a lot of these programs that we care about. One example that I'll give is HIV prevention funding at the CDC. So at one point, this was slated for complete elimination in the president's budget. And we saw that after a real outcry from the community and from our allies, uh, Congress did not allow that complete elimination of HIV prevention programming to occur. And that's really only because we were so loud and so passionate about making sure that that programming continued. Otherwise, I don't think that there would have been the political will to be able to stand up to the administration and push back against them. So there really is a powerful change that is made from everyday people, not just protesting in the street, although we very much encourage that, but also calling their representatives' offices and making sure that their passion and their opinions can be heard and followed through on.
Thank you both, Mike and Lizzie, for those answers and responses to the question. I do have a question. I received it here in the chat. Lizzie, can you elaborate on, does it really matter for us to call our representatives, and what impact does that have on current legislation?
Yeah, so that's a great question. And I actually get that question a lot from my friends who don't work in the advocacy space. It absolutely matters. When elected officials hear from their constituents, the folks that have the power to vote them in and out of office, it does have the power to change their stance on an issue. Because if they believe that their community, who they're representing and who has the power to vote them in and out of office, believes really strongly in a certain policy position, they are definitely likely to either double down on that stance if it's in alignment with what community is saying, and it can embolden them to take more action, or can really lead them to change their mind in significant ways. We've seen that honestly with Senate Republicans, hearing a lot from their constituents who were impacted by the Trump administration's cuts to NIH funding. And they were able to see from the contacts that they were getting from their constituents that that these cuts were having economic impacts in their communities. And we've seen a number of those Republicans actually lead letters to the administration and step forward in really powerful ways to oppose those funding cuts. So yes, absolutely, you calling makes a difference. It has the power to change the actions that an individual legislator takes. And it also has the power to change the discourse between legislators on the Hill and in the halls of power. So one call, especially handwritten letters, if you're someone who likes to send handwritten letters, those get delivered directly to the desk of the elected official because they receive so few of them. So you really do have the power as a constituent to make that change. And on behalf of someone who lives in Washington, D.C., and who does not have a voting member of Congress, I really implore you to leverage the power that you have, being a constituent, if you're not in DC or one of the U.S. territories. But if you do have a voting member of Congress, to leverage the power that you have there.
Awesome. Thank you so much for that, Lizzie. I appreciate it. I think David has his hand raised. David, do you have a question?
Hi, can you hear me? Hi.
Yes, David, we can hear you.
That was my question for Lizzie. So thank you, Lizzie, for answering that question. I think many voters still feel our voice doesn't make much of a difference, and that was a great tip about actually writing a letter. I haven't done that in a while. I will do it. And then another question, you talked about the Solidarity Project. If you could give us some more details about that.
Yeah, absolutely. So, as I mentioned, a lot of the really critical infrastructure for TB research and development across the globe was heavily damaged by cuts made by the Trump administration. Unfortunately, even though we don't typically see TB as a partisan issue, it did get caught in the crosshairs on a lot of very politically charged research topics. So, for example, if you heard anything specific to what the administration has called dangerous gain of function, uh, there were a number of TB studies that were in no way dangerous, presented absolutely zero risk to humans who are affected by TB, but were slated for cancellation under NIH grants because they were mistakenly designated as this dangerous gain of function, when really they were life-saving studies that were helping us understand more about drug-resistant TB and how we can best fight back against that drug resistance as it's emerging. So a lot of this really uniquely hit the TB R&D community, and looking forward into the future and realizing that this would not be the political reality forever, and that we had so much to say and so many stakeholders who wanted to have input on how we can rebuild once the political conditions change, we realized that we had to put forward a document and a vision that would allow us to hit the ground running as soon as those political conditions changed. So what we're hoping to do is convene all of these stakeholders. Again, it's the folks doing the research themselves. It's the folks who are participants in the research, who stand to benefit the most from new innovations in TB R&D. Advocates, people who have experience with TB, whether it's through being a TB survivor or caring for someone with TB, and so many other folks who have direct experience either with the implementation of TB technology or with the research of it, are able to provide that direct input into what we want to see as soon as we're able to hit the ground running. So we're convening those stakeholders and we're putting together a kind of blueprint, a policy document, a vision for what that rebuilding will look like when we have the available funding and the political will and the space to be able to rebuild that infrastructure as fully as we want to. In all honesty, we thought about this in response to the way that the Heritage Foundation and a number of other conservative stakeholders put forward their vision for conservative policymaking in advance of the Trump administration's rise to power through Project 2025. And we realized that we had that same opportunity to push back against that kind of destructive forward planning and really put forward this life-saving and human rights-based approach in a forward-thinking kind of way. And that's why we named it Project Solidarity First. It's a direct response to the administration's America First global health strategy that they've put forward. And we're saying that we do not believe in an America First approach. We believe in a solidarity first approach, in a human first approach, in a science first approach. So that is what we're going to be doing over the course of the next year and hopefully in the years to come in both writing down that vision and getting it on paper so that it can reach as many folks as possible. And then also, hopefully in the future, working on getting it implemented wherever we can.
Absolutely. Thank you so much, Lizzie. We appreciate all the questions coming in. The inbox is really on fire. I love people asking questions about the work that we are doing here at TAG. We do want to be mindful of the time, so I'm going to ask one final question to the HIV team, and then we will move into a close. If you have any questions regarding any of the work that's being done with our team, I encourage you to please reach out to us directly, and we can answer your questions accordingly. This question is for the HIV team, and then we will end with a closing statement. For the HIV team, if HIV funders had to focus on one effort to end the epidemic, what would that effort be?
You know, that is a great question. But I find I need to push back a little bit on the question because unfortunately, the times that we're finding ourselves in is that there's no one issue that takes precedence over any others, right? As it relates to, not just HIV, but also, Hep C and TB, there are very intersectionality based considerations that need to be elevated and continue to be elevated, rather. And this goes to the earlier question about what I'm hopeful for. I think that what I have found thus far over the past year and a half that gives me hope is the fact that there are many organizations, many people, many public officials, even, people in leadership who understand that intersectionality, unless we're advancing intersectionality and sort of focusing in on the margins, people who are most disproportionately impacted by not just, HIV research or specific policies, but all of the, all things, the anti-trans wave of just horrible, horrible policies that are being passed. The fact that Black people, for instance, who worked in the federal government, were disproportionately impacted by the reductions in forces, right? There's so many issues and so many things, developments that have happened that my personal opinion is that no one takes sort of priority over any others. We really sort of have to, depending on the context, depending on the program, depending on the geographic location, even depending on the particular population that's being affected, we have to advance an intersectionality forward agenda, in this work. So I guess, maybe that answers the question, programs that are really focused on centering the margins, acknowledging the fact that, we've left constantly, certain groups behind, right? In our advocacy and our policy. And by we, I don't mean, TAG or any particular entity, but just, society at large, right? We saw it with the marriage equality movement, right? Where trans issues were deprioritized. And now we find ourselves in the current situation where, trans people are really being attacked at every angle, right? And so we know yet that transgender people are disproportionately impacted by HIV, and it's even worse when we're looking at sort of subsets of the trans community, such as trans women of color, right? So, I would say that is, I guess, my answer to the question, really sort of prioritizing and advancing programs that have that intersectional lens, as TAG does, and the HIV program at TAG, and many others. Many of our partners, share that lens as well. So, yeah, that would be my response. Thank you for the question.
Absolutely. And thank you so much, Rico. As we wrap up, I would like to leave you with this. Everything you heard today, the progress, the breakthroughs, the momentum isn't guaranteed. It exists because of people like you choose to believe in missions like ours. The work that TAG does depends on the community that believes in science, that access is equitable for everyone, and that no one should be left behind. If today's programs moved you, if it sparked hope, urgency, or just curiosity, I invite you to take the next step, to reach out to us for more information, to follow us on all social media platforms, and to support us in our work. Your support directly fuels our work. It's because of you that we continue to do this work. Thank you for your time, for your partnership, and for your belief in our mission. We're grateful for our path. We're grateful for you being present and helping us path the way forward. Have a wonderful afternoon, and let's keep the conversation going.